probably joined us and you were here at the district. And I was able to say, by show of hands, how many of you have been here before? But I won't do that this time, obviously, because it's unless you're all going to chat at me. So at any rate, thank you for joining us today. I'm Barry Jantz. I'm the CEO of the Grossmont Healthcare District. And Erica Salcuni, our communications director, is with us today, and she's going to be helping me with the meeting. And our executive assistant office manager, Crystal Sloan, is also joining us today. You may hear from her from time to time. She was going to sit in the same office with me and hand me notes for anybody who chats or has a question via chat. But we seem to be getting an echo back from me on her machine. So she's moved into another office, and we'll see if we can function in that way. But thank you for joining us during this situation where we have to do this remotely and by Zoom. I'm sure you're all Zoomed out in recent weeks and months, but we're going to move ahead and do it that way, and we hope we can get the information across to you. Last year was actually the first time we did a grants program. I'm sure several of you I've dealt with in the past, you know, with technical device, by phone, by email. But last year we decided, at the prompting of our grants committee actually, was to actually set up one of these so we could bring you all together and answer questions in one fell swoop as we're starting on our grants year. And of course, we're about to start on a new grants year for fiscal year 2020-21. I didn't think I'd ever say those words a few years ago, but here we are in 2020. And that our grants year actually starts on July 1st. I think you all have the grant materials. Crystal has sent them out. If you actually don't have them, if you go into our website, you can, under our grants page, you can find all of those materials and you can take a look at those. If you haven't looked at the grant materials and you decide after this forum today that you want to take a look at them in more detail and you have any questions, you can feel free to reach out to us at that time. So anyway, I just welcome you again. Erica, is there anything you want to say before I really get rolling here?
Hi, sorry. I just want to double check and make sure everyone's on mute, and it looks like you all are. So thank you to everyone for the technicality. I think the only thing I would say besides thank you for joining us is if you have been a grantee of ours in the last year or two, you have probably been with us in the capacity of discussing grants at some point during the beginning of 2020. What we're trying to do for those who are in an active contract with us is sort of build a network that kind of focuses on education, regional resources, and things we can do to help you strengthen your work so that we can ultimately strengthen our network. So I see our Q&A for potential grantees and the resources we're building for those of you who do get awarded a grant as being symbiotic in some ways, and we just thank you all for your interest.
Great. So thanks, Erica. And Crystal, is there anything you want to remind us of before we move ahead? She may have to unmute as well.
I thank you, Barry. I did unmute. No, just if everyone could please keep muted unless you're asking a question, and Barry can talk about when questions are appropriate. And just, you know, be respectful of each other, try not to ask over each other, that sort of thing. This is my first live Zoom video technical thing, so please forgive any glitches, and we just really appreciate your interest in the district.
Thank you, Crystal. So we are going to move ahead. Part of the reason Crystal was going to sit in the same room with me so I could just nod my head to her when I was ready to go on to the next screen. So you may hear me saying that now since she's not here. But go ahead, Crystal, move on to the next screen. So I think we've already kind of done introductions. You've met the three of us that are going to be involved today, principally myself and Erica. And of course, it is to talk about our application review process this year and take any Q&A you may have. I'd like to invite you this year to, because we're doing it via Zoom, if you would prefer to ask a question via the chat in Zoom, you can do that. Crystal will be monitoring those, or you can certainly ask them verbally as we move through. I think that there's at least one break in the middle of the PowerPoint presentation to see if we have any questions at that point. I'm assuming most of the questions will be at the end. You can go on to the next page, and I think it's just a picture of us when we look nice, when we're not in COVID-19 mode and wearing polo shirts like I am today. So that's how we look, you know, when we're supposed to be, you know, really working. So anyway, move ahead there, Crystal. So there's a picture of the district. We are East region of San Diego County, and you will see we've taken the border with Mexico. That eastern border of us is within a few miles, about 15 or 20 miles of the Imperial County border. And that's about 1/5 of the landmass of San Diego County that we take up. And you can see the western portion of it is where the most populated areas are. That's La Mesa, El Cajon, you know, Santee, that area. And so the interesting thing about some of the history of the district as a government agency is this district was formed back in 1952, and the hospital was first built in 1955, Grossmont Hospital, and that the hospital itself is on the western edge of that map as you see it. And so, you know, we've always scratched our heads about that a little bit. And I think probably when the district was formed, they were looking at where the needs were going to be. And there was already population to the west of us in San Diego. And so they made this district an East County district. And they probably made it stretching all the way out to the nether regions in the east to take into account the fact that they'd maybe have a hospital out there one of these days. Well, one of these days, of course, is now, you know, close to what, 70 years later, and there's no hospital. That's certainly not a district hospital out there. You have to go to Imperial County before you find any other hospitals. There, of course, Scripps East used to be out there. You know, it has since closed. It's been well over a decade. And the interesting thing about it is if you're on the eastern edge of our border out there, you're pretty far away from the nearest hospital. And that makes our demographic interesting for various reasons, geographically, and you know, you'll hear some other things maybe about that today. But next slide. I talked a little bit about the history. There it is on a timeline with 1955, the hospital being built. And then in 1991, a lot of you probably know this history, but I'll just gloss over it a little bit, that in 1991, with healthcare costs going up in the late 80s and early 90s, as you know, of course, they continue to go up, as we know, but back then it was a concern. And a lot of these government agencies, these district hospitals, there's about 78 of these around California, they had a single hospital. And the reason they started in the 50s and 60s was because the private sector did not have a hospital in a growing rural area. And so they were formed to provide the service, much like a water or a fire district is formed. But in this case, the less common hospital district formed to provide a hospital. But by the time you get to the 80s and 90s, these government agencies that had usually just one hospital were finding that, well, how do we compete in an environment where we don't have the efficiencies, the economies of scale, the leveraging that can be attained through contracts, because we only really have just one hospital, where larger systems are going to find themselves more efficient and be able to keep costs at least spread around a larger system because they've got more than one hospital. So the legislature in the late 1980s changed the local hospital district law to the healthcare district law. There was a name change, and as part of that name change, the legislature said in the state of California that these public hospital districts in which the government agency operates the hospital, in which the public owns the hospital, they can enter into arrangements with other providers of service to operate those hospitals through a lease or an affiliation or whatever it may be. And that gave a lot of local hospital districts that were having difficulty keeping open the ability to enter into an arrangement which would keep the doors of that hospital open. And so we were one of the first ones in 1991 to enter into a lease with Sharp Healthcare. And from Sharp's perspective, not looking at it from our perspective, but looking at it from Sharp Healthcare's perspective, they had other hospitals in the area, as they still do. Sharp Memorial, Sharp Coronado, Chula Vista. They've got Sharp Mary Birch right there on the same facility as the Sharp Memorial campus, and on that campus. They didn't have a presence in East County at the time, and of course they desired one that makes their system more solid, more efficient, and gives them a presence in a part of the county where they didn't have one. And how would they do that other than having to buy a hospital or build a hospital? In this case, they did it by leasing an existing hospital from a government agency. So at that point, it was really the beginning of a public-private partnership between the government agency, Grossmont Healthcare District, and Sharp Healthcare for the operations of Sharp Grossmont. And after a couple of years, we did say, you can go ahead and put your name on it. The public still owns the hospital, but we are in a lease, and it makes sense that they would be able to put their name on it from a marketing standpoint, so everyone understands it's part of the Sharp system. And so that started in 91. More recently, in 2014, we sought a lease extension. That original lease was till 2021, and which is right around the corner. So a few years ago, we were coming up on that, about 7 years away from the end of that lease. And we went to the voters and asked if they would allow the elected board here to extend the lease for up to another 30 years with Sharp. And the voters overwhelmingly said, I think it was about 87 or 88% of the voters said, yes, go ahead and do that. And that extended that lease till 2051. That means I don't have to worry about another ballot measure to pursue a lease extension in my lifetime, I think, at any rate. So go ahead, next slide. That's a little history. I probably missed the fact that as a result of that lease in 91, it was a few years before the district board said, we're still taking property tax dollars in. We get about 1/64 of your property tax bill. That's what it amounts to. And for those, all the properties in that map that I show you, the East region. And, you know, here Sharp is operating a hospital using their monies. And that frees up the tax dollars to support some things. And that's when we started our grants program in about 1995, 1996. So we've, at last count, I think we were well over $60 million in support throughout the community in the several years since 95, 96 when we started the grants program. You can see some of the recent grantees are on the list there. And I won't go over them, but some of you sitting in the room are probably on the list, and that just gives you an idea. In recent years, the focus has been much more on direct patient care, and we'll get into that as well. So moving forward, you can see last year at a glance. Now Erica's role as communications director has really been helpful in going beyond just saying direct patient care, but what do we mean when we say that? So you can see the areas are broken down. You can see aging. And by the way, when you look at the East region of San Diego County, that 1/5 of the San Diego County area, the highest number of seniors are in this portion of the county. And that speaks to why a lot of our money ends up going to aging. We're also in behavioral mental health, cancer, and chronic conditions. We're going to get into this because we've really specified that in the grant application starting last year, and then we refined that this year. But you can see some other things, disability services, social services, workforce development. When we say workforce development, that means the future healthcare workforce. So this is where we're really involved in supporting those who are studying, all the way from high schoolers to those pursuing advanced degrees, and providing scholarship dollars for the best and the brightest. And our money in recent years, probably it's been well over a decade now, that the only time we fund other government agencies is when it's for the purpose of educating the future healthcare workforce. So that means things like, you know, the Grossmont College, you know, nursing program. We funded the cardiovascular tech program at Grossmont College over the years. So that's the workforce development piece. So let's go to the next slide. This year, you can see we've got a budget, which is spelled out in our grants policy, of $2,520,000. $1 million of that, right off the bat, goes to our community hospital. So that means either directly to the hospital in the form of a $1 million grant to the Grossmont Hospital Foundation. But the last 8 years now, that's been through an IGT. That's an intergovernmental transfer. And that's something that is set up that the state of California administers with federal dollars. And this is at the federal level, the feds saying, we understand that we don't give all the money at either the federal or state level to hospital for providing the services they need to provide. And so therefore, we're going to find a way to supplement some of that funding we provide. And this is one way. And that is if a local government agency provides some funding, the feds essentially match it, and the state of California administers that. So for several years now, it's typically been $1 million. The last couple of years, it's been higher. The year we're in right now that we're about to close out, we actually did $3 million, and that comes back with a match. So our $3 million this year was worth a $6 million benefit to Sharp Grossmont Hospital. In most years, it's been $1 million, where $2 million comes to the hospital. And the board is very supportive of that. The healthcare district board is very supportive of that because they see that as their tax dollars being used to get some of our tax dollars back into the local community and to our hospital. So that's just to explain why so much of our grant dollars does go to our community hospital, because number one, our community hospital is our number one mission. And that is not something that we have discretion over. That is the principal reason we're here as a government agency, is to ensure that hospital continues to operate. Whereas all the other programs we do are discretionary. There's no state law or local law or anything that says we have to have a grants program. We've been doing the grants program for community-based grants since 95, 96, because the board has been very supportive of finding a way to get our dollars outside of the four walls of the hospital to ensure that healthcare is viewed as broader community health, not just within the hospital. And so the other pieces of it are, I mentioned the scholarships just now. You can see how much money is allocated there, $210,000. And then $709,000, a little bit more than that, for regular grants and sponsorships. And this year, like last year, we're allocating a certain dollar amount to prioritize needs in the community that have been identified in health needs assessments for the San Diego East region. Last year, there was $500,000 allocated for that. This year, we decided to increase it, but we decided to increase it without diminishing that amount you see above that, the $709,000. So we increased our grants budget by about $120,000 this year. And you can see down below that, here's where those prioritized needs are this year. Aging concerns, behavioral health, that includes mental health and substance abuse, and then chronic conditions in three major categories: cardiovascular disease, type 2 diabetes, obesity, and then the last one, cancer. So again, this is these are for grants that you can start asking for now. We can start considering them after July 1st. Our year is a full-on fiscal year through June 30th of next year. But you will see in the policy, the grants policy, that we're really looking for those who can submit their grants to us by December 31st of this year. We want to know how much money we have left and what's on our plate to consider by the time we get into the last 6 months of the year. But I need to be very clear on this. If you believe that means you can really wait till December, a lot of people have learned in recent years that that is way too late. If we've been out of money sometimes by November, certainly by December, most absolutely by January, we're really out of money. So the sooner you can get your application in, the better. That makes it difficult for us in that we understand in July and August and heading into September, we have a pile of applications. That may mean that we don't get to yours right away because I've got a grants committee, which is 2 people, and a board, which is 5 people, that are going to want to review those and do it judiciously. And sometimes when you have 20 or 30 applications, you simply can't do that in 1 month's time. But so sometimes it takes us 2, even 3 months to slog through all of those early grants we get, but that's okay. The important thing to you is to know that if you wait until September, October, November, you may be in trouble because we may be considering the pile we still have left to look at along with some late arrivals against fewer dollars because we've spent most of that, just those discretionary dollars that we have. So you can go on to the next slide, Crystal. So some key points I like to remind people of every year that you should keep in mind. No entitlement to funds if funded in previous fiscal years. I think it says that 3 or 4 different ways throughout the application and the grants policy. There simply should be no expectation on any past grantees' part that they're guaranteed funding in future years. Now, you certainly can ask for a certain amount without it requiring a 4/5 vote of the board based on monies you received in the past, but there's certainly no entitlement. We're always looking for new and innovative programs and services to deal with changing needs. That's reflective of the fact we're now focused the last 2 years on really prioritized needs identified in health needs assessments. Another thing, will the grant funds assist the underserved? And this is a key thing. This is a couple of conversations I've had in recent weeks with folks where they've not understood why we've struggled with funding them. They're doing good work. It may not be directly healthcare, it may be something else, or you can make an argument that it is healthcare, but sometimes it comes down to whether the services they're providing are something that their population can pay for already on their own without our dollars. And so we will be looking at whether you're serving an underserved population or not, and that's one of the factors we'll take into account. We've already focused on this direct patient care. It says right there, grant applicants not providing direct patient care may be deemed ineligible. And that really comes down to, we're going to look at other things. And it says down there on the asterisk, social determinants of health. We're getting more and more into social determinants of health. If it's things that affect someone's health, we may be more focused on that, such as transportation. I wouldn't call that direct patient care. Getting to an appointment is, but that's different than seeing someone at a clinic. So, but we are beginning to understand, and we're trying to focus on that and trying to have our board focus on that as much as possible, that sometimes social determinants of health drive someone's health as well. And so we are focusing on that, but just a key thing you have to remember is it's still a limited funding supply. So when there's limited dollars and we're looking at a limited remaining funding pool, and one of the requesters is a community clinic, and another one is a transportation program, it could come down to the grants committee and the board members saying our priority is the community clinic. The next point here, eligible recipients of major grants or sponsorships, 25,000 or greater in a prior fiscal year should be eligible for funding of no more than 100%. Okay, now without trying to read that 3 times over, it really comes down to this. If you received a grant in the past of say 30,000, you're eligible to be considered for 30,000 in a subsequent year. Are you eligible for more than that? Yeah, sure you are, but it takes a 4/5 vote of the board to approve any higher amount. So could you ask for it? Could you justify it? You can certainly try to do that. If it's two services, two former grant recipients that are collaborating and come to us, and because they're collaborating and working together, one of them is asking for more than they received in the prior year, but the collaboration itself is saving us some money. Obviously, we're going to take that into account. Those are things we like. But this was to guard against creep. Someone asked a question last year after this grants workshop, and the question was, since you recently implemented that new mandate of no more than what you got in a prior year, that really keeps us, a grantee that's receiving less than 25,000, from ever getting more than 25,000. So how do you kind of explain that? That was the question. Well, so let me answer that, because if someone asked that, even though I don't know who asked that, if someone asked that, it could be that others of you have been thinking that and haven't wanted to ask it. So let me make it pretty clear that that is not a new policy. That policy has been in place for several years, for at least 7 or 8 years. In fact, a few years ago, we even said you could only ask every other year. That only lasted 1 year, and that was even more onerous than a funding cap. But the policy of saying you can't get more than you received in a prior year has been in place for many, many years, with the understanding that if you get a 4/5 vote of the board, you can get more. The thing about less than 25, it only applies to those getting 25,000 or more. So for anybody who's getting less than that, say $15,000 grant, or even a $5,000 or a $10,000 grant, to think they're limited to 25, well, that's simply not accurate. If you're getting 15,000 from us, you're not limited to what you got in a prior year. You could come and ask for 100,000. Now, would that be the smart thing to do? Probably not. But the point is, if you're getting less than 25, you received money from us in the past, you're not limited to only asking us for 25. You can ask for more than that. That doesn't take a 4/5 vote. That takes a simple majority. So I just wanted to be clear on that. And if you have any questions on that, please let me know. I already talked about collaboration, but it's the last point here. Priority consideration may be given to proposals that demonstrate collaboration amongst providers, reducing costs, increasing efficiency of services, etc. So I'm going to stop here and see if there's any questions. Crystal, do you have any on the chat that we could try to answer right now?
Sorry, I have been able to answer everyone's questions, and I think most everyone, the questions have been directed to everyone in the chat box. So some were questioning whether if they got COVID money, does this affect next year's money? I explained that it doesn't. They're separate pools of money. Someone asked about whether the cap is the same for prioritized areas or not prioritized areas, and I explained that the cap is the same. So most of the questions, as I said, I've been able to answer, but does anyone have any that they want to ask either in chat or live?
Don't be shy. Okay, just let me know if there's more in the chat and we'll move ahead. Oh, and if anybody is asking a question right now and forgot they're on mute, you might want to unmute yourself, because we're not hearing any.
Hi, my name's Loretta Turner. Can we hear me?
Yes, Loretta. Hi.
Hi, how are you? I was the one who originally asked if you're applying for a grant, but sorry, forgive the seagulls, but if you're applying as a grant, applying for a regular grant, but it might fall under one of those prioritized needs. You don't have to apply separately, but I'm just curious, if the organization were to win that grant, how does it get allocated?
Okay, I guess I'm not understanding the question, Loretta. So
Sure.
if you apply for one of the prioritized grants,
Mm-hmm. So
is that what you're?
let me explain. I guess let me explain the situation we're in. So I'm with the Burn Institute. We have gotten generous grants from Grossmont several years, and typically what happens is that funding goes towards all of the programming that we do in the East County region.
Okay.
But now that you guys have aging concerns as one of your priorities, we do have a particular program that speaks directly to aging concerns. So I'm curious if is it like a separate pool of money that would go towards
No,
aging concerns?
it's not a separate pool of dollars. Well, we've got $2,250,000. It's broken up for us in the way I just described on the previous slide, where there's about 600,000 for the prioritized needs. It used to be that $700,000 pool essentially, and the $600,000 pool were combined really as one thing. And whether it was a prioritized need or not, we just looked at it out of that entire pool. And we're specifically saying, we're taking that $1.3 million and we're saying, we're setting aside 600,000 of that for these prioritized needs. And so because they're prioritized, we're going to be looking, we're hoping people move in that direction is really what we're after. Does that make you ineligible if you don't ask for that? No. But I can tell you last year, the 700,000 piece, the general community grants, non-prioritized, went way more quickly than the prioritized needs. And the prioritized needs portion was only 500,000 last year. And I think we ended up expending it all at the end, but it didn't go very quickly. There was more competition for that larger 700,000 pool of dollars. So we saw some grantees, traditional grantees last year, move their programming over, or at least what they asked us for, into the prioritized area. We'd really like to see more of that. So I hope that helps, but if not, we can talk offline as well.
Okay, yes,
Barry,
thank you so much.
Barry, this is Crystal. So if, for example, the Burn Institute had general services and a portion of their services for aging, how would they apply? Would they apply twice, once with the prioritized monies and once for the general monies?
We're still going to consider everyone against the dollar amount they've received in the past. And I think Burn Institute, it is 25,000 if I recall, for several years now. So you wouldn't submit 2 grant applications. I mean, if you wanted to say that, hey, we're focused more on one of your prioritized needs here, Grossmont Healthcare District, than we have in the past, we're certainly going to take that into consideration. So Loretta, if you said, hey, half of what you're asking for is for prioritized needs and half is for our regular programming, that might even help you, but we're going to look at it from the standpoint of whether you're doing anything in our prioritized needs area. Okay.
Wonderful. Thank you so much.
All right. Any other questions? Okay. On the next slide, it talks about what should a good.
Wait, Barry, I'm sorry.
Yeah,
there is one other
Erica.
question. There's one other question from Ricardo Forbes. I think just looking maybe for a little more clarification on the limit, the funding limit.
Okay.
Please explain again your policy regarding the limit on the amount an agency can apply for relative to previous year amount.
Okay, well, what I'd suggest is, instead of me trying to explain it again, you read the grants policy, but essentially it means if you've received 50,000 in one of the last 2 prior years from us, that is what you can be considered for with a simple majority vote of the board of directors here. If you would like to seek more than that, you can, but it would take a super majority vote of the board to approve any higher dollar amount. That's the core of the meaning. where you may be asking is if you have received less than 25,000 in years past. If less than 25,000, you are not limited based on what you received in the past. So if you look at the grants policy, it spells this out pretty clearly. But if you read it and it still doesn't make sense, you can email us, you can call, and I can try to give you further detail on that. Does that help, Erica?
Oh, definitely.
Okay, I'm going to move ahead. So a good quarterly report. We obviously, don't do this in a vacuum. We certainly have an expectation that if we're going to give you some dollars, you're going to submit a report to us on how you're doing with those dollars and whether it's meeting the goals of what you stated in your grant application. And we ask for that to be done on a quarterly basis. We provide that document to you. And so it says right here, a good quarterly report gets into the details of ways you're working towards the grant stated goals. Data is always helpful. Some people have said, well, doesn't your board like to see photos and things like that? Well, that's fine, but that doesn't replace data. In most cases, the board is probably not sitting and looking at quarterly reports unless they specifically ask to see someone's quarterly reports. If we do get something with really nice photos, sometimes we share that with the board because of the nice photos, but that still doesn't replace the data. So at a staff level, we're really focused on the data. So be specific with numbers. For example, number of clients served, referrals, follow-up numbers to show the program is working, etc. So I hope that helps. There's a couple of little cartoons there.
I will say the communications director does appreciate photos, not only for our board, of course, but really to highlight what you do for the rest of our community. And there's no better way to do that than visuals. So certainly data would be more impactful as far as what we're reviewing and outcomes at the board level and at a staff level, but for our desire to help share what we do as a district through your services, the communications director would love some good photos.
Yeah, and I'd say maybe a good quarterly report maybe has both. But if you're only sharing photos and no data, that's probably okay. Well, yeah, your photos are nice, but where's the data? Now we understand in some cases if you've asked for a transportation vehicle or a piece of equipment or something like that, the equipment's purchased, it's in use, and you're done. You feel like you're done, but of course we'd be interested in, okay, now that it's in use, how many folks are you transporting? How many patients have been able to use that piece of equipment? That's data as well. But of course, a photo of the van and a photo of the new equipment is always handy as well. And plus, we want to use our social media venues to promote not only what we're doing, but to promote you as well. So that's where a photo can certainly come in handy. So I'm seeing questions pop up. Crystal, are there any more relevant ones that just came up? They flash on my screen for a second, then they disappear.
That's okay. Some people are saying they love my cartoons. Woohoo!
All right.
There is a question, you mentioned equipment. What are the restrictions on equipment?
That's in the grant application as well. So let me just get into some general restrictions. So the number one restriction is that it needs to be used for the East County patient population. So a lot of our grant applicants service more than East San Diego County, and we understand that. Some of them don't even have offices here, but they provide some services here, or they maybe have satellite programs here and their main office is outside the East region. We understand that. It addresses this in the grants policy, by the way. And so the specific thing on that is whatever equipment is being considered needs to be utilized in East County. I think that's one, or at the very least, utilized for the patient population in East County, even if they may be leaving East County to use that equipment. And it really needs to be dedicated to the East Region patient population, and for that reason. Now, we understand in the case of, say, a transportation vehicle or something like that, it may be for the population base here, but it may be traveling obviously outside of East Region, maybe used for wider spread services, and we understand that. What we do like to understand is what portion of the total cost of a piece of equipment or a vehicle or a capital improvement is benefiting the East Region population, and the amount of money that's being asked for it is commensurate with that piece. So, if it's a $200,000 each piece of equipment, and one quarter of the patient base is from East Region, we wouldn't expect you to be asking us for $200,000. We'd be expecting you to ask us for, 50 or less. So I hope that kind of helps. There is one other restriction, and this is a significant one, and this has to do with capital improvements, so remodels. If you're doing construction, we're a government agency, so our dollars can only be used for labor that meets prevailing wage guidelines. And in some cases, depending on where your other money's coming from, folks haven't wanted to do that, so therefore they don't want to ask us for any dollars in which it would mean all of their labor has to be prevailing wage. So oftentimes they've gone in the direction of equipment or something like that, where there's no labor involved. You're buying the equipment to go into a remodel, and therefore it doesn't meet that restriction. But if you are doing a remodel, you have to think about the fact that as a government agency, the construction labor must be done prevailing wage. Does that help? Everybody's cheering, so I think that was the case. So Erica, I think we're maybe at a point where we're going to go to you, and how did we get here as we focus on our prioritized needs?
Sure, thank you, Barry. So just for those who may be on this Zoom call right now wondering what the health needs assessments are, or how they come to be, or what is it that actually brings prioritized needs to the point that they could be called out, as we've done in our policy. So I think as far as how did we get here, if you want to advance to the next slide, I wanted to just point the group to a couple of resources. So I think I'm preaching to the choir with this philosophy that health is a state of optimal physical, mental, and social well-being, and not merely the absence of disease and infirmity. So you can advance. Why would any of us want to echo that point? Well, because we know that regardless of what you're focused on in your organization and the services you provide, there are social factors that affect everyone's health. The less resources a community may have, the more some of the social determinants of health might come into play, as far as having a lot of the time a bigger impact on a person's health than just the quality of the care or their genetic makeup. So this is just a total snapshot of how other medical stakeholders, this is from Kaiser Family Foundation, this is kind of one way of framing the social determinants: economic stability, the environment. I'm not going to list them all, but everybody can clearly see that there are a lot of outfits out there doing research on the social determinants to show that health is about more than just whether we're taking care of people who are sick, be that inside or outside of the doctor and hospital. So if you want to move forward as far as how this is looked at in San Diego County, we do have a hospital association. There are 7 or 8 health systems that come together to do formative research, quantitative and qualitative, to come up with these top health needs. So this is not the Grossmont Healthcare District. Neither at the board nor staff level do we sit down and come up with these issue areas ourselves. They are identified through a 3-year process, really. So the last time, thank you, the last time any research was done with this group to get new health needs prioritized was in 2019, and this is what came up. So what you just saw circled on the screen, if you haven't seen this report yet in any other venues, this is just kind of some of the why that we like to point out for the benefit of our potential applicants, so that you can understand these prioritized needs are not arbitrary. They're not arbitrarily decided, and we would be happy to get you a little more information on this particular report or this process after the call if you're not already familiar. So for those of you that are familiar, you're well aware that aging concerns, behavioral health, cancer, and chronic conditions are issues that go beyond just the East County and beyond just San Diego County in a lot of cases. They are determined through a lot of factors that we won't get totally into here, but this is a resource that we would suggest you look at if you're trying to, so to speak, get there with a social determinant based program. If you want to move to the next slide. The Community Information Exchange is another regional resource, just like the Hospital Association's Community Health Needs Assessment. This is another tool that it's a little newer. So for those of you who are not familiar, 211 San Diego is the organization that is kind of overseeing its development, the Community Information Exchange. Essentially, it is a way, in our view, for social service providers to collaborate with one another and with 211 by sharing data. So this is just a feature that we as a district feel we want to share for your knowledge. It is something that they are trying to build as we speak. I believe the next slide will show, and I don't go there yet, Crystal. I believe the next slide will show kind of, you know, how many organizations are involved that we work with through our grants program already. But essentially, the features include a network of partners, a shared language, and by shared language, it's just, you know, the data inputs, and there is just all kinds of ways that there can be bi-directional communication among providers through this platform. So not going to get into all the nuts and bolts of it. Did want to just mention it's a regional resource we look to and that we are looking to become more educated on when it comes to asking all of you to work together and collaborate, because we know that that's not as easy as picking up the phone and calling a fellow grantee or a natural partner and saying, hey, let's write an application for a grant together. So can move on. Just a couple more points about the CIE, Community Information Exchange. The reason it exists is to address social determinants. So as you look at the little guy in the graphic or person, you will see, again, just another way of framing the social determinants. This is how it's done through the CIE: housing, transportation, healthcare, food, income, and benefits. These are all things that affect a person's health. 211, for those of you who are not familiar, it is a call center, but it's more than that. It's a resource and referral maker. And these are the calls they get. These are the things that people need. So it's a reason the district is spending time talking to you about it today. It's a reason it's come up with some of the convenings we've done with our grantees, and it's a reason it's coming up again with hopefully all of our future grantees. So if you move to the next slide, these are just some of the folks that are already on the network, and by no means are we requiring grantees to join this network. We are letting you know it exists because chances are, even if you or a colleague within your agency are not already aware of this resource, you can see that a fellow partner probably is, just based on this slide. So again, just sharing some of the regional resources that we hope can encourage you all to understand where we're coming from as an agency when we ask you to collaborate and when we ask you to consider priorities. If you move to the next slide, that was really all I had to add as far as what you've heard today. So I think turning it back over to Barry, Crystal, and I'm
Sure.
happy to answer some of the questions myself based on what we just went over, but.
Let me do a couple of key points that I think folks usually need to hear, and then we can go to general Q&A. One is I offer this every year, and I offer it at all times. I oftentimes offer it when people call me on the phone and they've got questions and they're trying to figure out if they should submit a particular grant application or not. Let me offer it generally here, and that is if you have curiosity about whether you're spinning your wheels by submitting a particular application, there's a process, and that process, which I advise people to, is send me an email or send me a letter which describes what it is you're thinking about submitting, understanding that communication to us could become public if anybody was looking. In most cases, people aren't really looking at it, but just keep in mind it's kind of more a formal communication that you're really seeking advice from us on whether you're going to be spinning your wheels on a particular application. I don't want you to have to spin your wheels filling out a long application only for us to say, well, why didn't you ask us if we thought that was a good idea before you spent all that time on it? So I'm trying to cut out that heartbreak for you. You send us a letter, I can take it to the grants committee, which is 2 members of the 5-member board, and they're the ones that are making recommendations on grants, and we can actually get their feedback on whether they think it's a good idea or not. If they don't think it's a good idea, you probably don't have 2 votes to begin with on a 5-member board, so why would you even try? But if they say, hey, that's a good idea, it's no guarantee, but at the same time, it'll save you from having to sit down and do that application. So that is an offer to you at any time. If you'd like to call me or email me and talk to me about that first, we can do that. Another thing is sometimes people think Erica and I are part of the voting committee. We're not. We advise the grants committee, but we don't have a vote in the process. It comes down to 2 members of the committee and then 3 additional members of the board. And they are elected officials. They are publicly elected officials. And I think this is key. Although we have what we believe is by issuing a grants policy, a grant application, which we set out the criteria, we set out the kind of things we're looking for generally that have been adopted by the board as what they're looking for. That's objective. That's objective right there. But you have to keep in mind that these are individuals that are elected to this board with different worldviews, different ways of looking at things, different backgrounds. And sometimes when it comes down to, are we going to do this one or are we going to do this one? Or are we going to be able to do this one at all? Or what do we like about this one versus this one? Or do we, those things are oftentimes subjective. And there's no way around the fact that they're going to have different perceptions and views of things. And that is just built into the process, as it is for any elected body out there anywhere. So I like to say that because sometimes people say, well, you're not being across the board fair on the way you viewed us versus them. Well, there's an objective application process, but sometimes the decision making does come down to subjectivity, and that's just built into the political process, whether you may like it or not. So I just wanted to throw that out there as well. Lastly, there is an odd thing in the state of California that says for these public hospital districts that the board members and staff cannot meet with you individually one-on-one for you to try to seek whatever it may be. Let's call it on one end lobbying, on the other end just input on what we think about something you're submitting, and anything in between. We can't do that. We can do that in this kind of venue. We can do that in email. I can get on the phone with you and I can do that, but neither I, nor Erica, nor Crystal, nor the individual board members can go and meet with you. And that the state of California tells us we can't do that. So you know, don't even ask, in other words. I'm gonna go to questions now. Somebody just said, can we get the PowerPoint? Yes, I think we can give out the PowerPoint, right, Erica?
Well, if you're going to defer to me, I'm going to say absolutely.
Well, I knew what the answer was, so I knew you'd say absolutely. Okay, who has other questions? Crystal, are you seeing any questions in the chat?
I am not at the moment. I did send a reminder to everyone, either ask your question in the chat if you don't want to ask it live, but you're welcome to do either. And then if it's something very specific or you don't feel comfortable, Barry is always available at a later date over the phone, as he said, to answer any questions.
But feel free to unmute yourself now if you have a question you'd like to ask now. And I would also ask Erica and Crystal if they thought there was anything that we may have missed throughout this.
Hi, I have a question. My name is Grace. I'm from Mama's Kitchen, and we serve 2 of the priority areas. Would it be best to apply to just one, or would there ever be a combination application?
Yes, so the application itself, if you look at the application, there's it lists these prioritized areas on the cover with a place to check the boxes. You may check as many boxes as it really means you're doing. We noticed last year a lot of folks were checking a lot of boxes. It was kind of a stretch. We'd really like you to assess, are you really addressing that directly or not? But yes, you can check more than one box.
Thank you.
I have a follow-up question to that, Barry. This is Melissa with the ALS Association, and we also have a few boxes that we can check on our application. Specifically, I was curious about the chronic conditions in the area of focus, being the cardiovascular, diabetes, and cancer. We obviously don't fall into those 3, but we do serve a chronic condition. So should we check that box or not?
There's no, we've built this thing around what makes the most sense to us in any one year, and we refined it from last year. And it doesn't mean there can't be future refinements in the future, going forward. But yeah, so don't think there's any hard and fast, like we're going to go, wait, you checked this box, but you didn't check one of the ones underneath it, So Melissa, I'd say, yeah, if you want to check that chronic conditions and then, do an other or something and state why it is. And I understand ALS probably falls in that category, and we will, we're not going to hold it against you. How's that?
Awesome. Thank you.
Anybody else?
Barry, this is Crystal.
Yeah.
I just wanted to say that we will follow this up with a survey, and we can attach the PowerPoint and a link to the recording as well afterwards.
Sure. Last year we shared the video of us actually standing in the room and doing this. This might be advantageous for people to be able to view the recording afterwards as well, so we can provide that. Let me see if I have any private. I noticed a couple people were sending me private chats. If I've missed you somehow and you sent me something directly and not to the group, and I've missed it, you can email me as well. My email is bjantz, BJANTZ @grossmonthealthcare.org. Any other questions? What's the last cartoon, Erica?
Why don't we give that one to Crystal?
The last cartoon is a man standing on a scale looking down. He's a little disheveled. He's in his boxers and his old t-shirt. And presumably his wife or girlfriend is there and said, maybe we should start social distancing from Grubhub, as the newspaper she's holding says average American up 5 pounds during lockdown.
There we go.
We're all in this
Okay.
together.
We're all in this together. Anybody who says we're all in this together probably isn't on Facebook and seeing how many people argue with that. But we are all in this together. So any other questions? I hope we've been helpful today. If there's any last quick things anybody wants to ask, feel free.
Barry, this is
Yes.
Crystal. We had someone ask, will delays in reporting due to COVID-19 affect a previous awardee's ability to be refunded?
Well, let's forget about COVID for a second. Let me tell you how I generally look at that, and that may help. If you are submitting a grant application, I'm looking at your prior one, if you're a prior grantee, and looking at when you were awarded last year. And generally speaking, I don't think people are waiting until their year's up and done before they ask again. It's usually, they're asking while their prior grant is still going. And so I'm kind of doing what I call just a simple gut check. I mean, if you're 3/4 of the year through the prior grant year and you're asking us again, I'm probably just making sure you've got 2 quarterly monitoring reports in the file, or maybe 3. So I'm doing that sort of thing. But I'm not so hard and fast as to think, okay, there aren't extenuating circumstances. If you were 3/4 of the way through your prior year and you're asking us for a grant, and I only saw 1 monitoring report in your file, the first one, I'd probably be reaching out to you to say, hey, you should probably get at least a second one in, because we're not going to consider your new one at the grants committee until you get caught up. But I'm always willing to work with you. I just kind of need to know what's going on. So yes, I'm going to give some leeway in the COVID environment as well, especially. Just help me understand. Don't let me be caught off guard looking at your new application and wondering why you haven't turned in any reports from the prior year at all. I'm looking at the reports being turned in when we're approving payments as well. So so if you haven't had any reports turned in for the prior year, you probably haven't been paid either. So that would be a good indication to you. But I hope that helps whoever asks the question. Anyone else? Okay. Well, thank you. Again, I hope this has been helpful. And someone says thanks for your work on the La Mesa Recovery Fund. Well, I'm glad I can do that in some of my spare time as well. So take care. Bye-bye.
Thank you.